The first thing I think it's so important for nurses is to really assess what the patient already knows and what does their family already know.
So what is an epilepsy nurse? What do they do? I know that not even everybody knows of their existence, and I sure didn't until I was being considered for surgery. Well, today we hear about some of the most globally influential epilepsy nurses, Patty and Ludivine. If you haven't done so already, please do like and comment on this episode and subscribe to our channel so that we can get way more people around the world learning about the epilepsies.
I'm Ludivine Rohrer. I am an advanced practice nurse specializing in epilepsy, and I work in a university hospital in Nancy, in France. I work as a clinical expert in nursing care because I work in a monitoring unit. EEG monitoring unit, and we do some surgery. So I can see some people with epilepsy for their follow-up.
And is this for children or adults?
We can have some children, but just adult for me. So I can do their education.
Or in all their sort of needs, like the care-wise, you mean?
All their needs, yes, nursing care, but also in their comorbidities, I can give us some support with the psychosocial aspects and with troubles in mood.
Oh, so like mood disorders, cognitive dysfunction. And I heard that, I heard through the grapevine that quite a lot of your, the people that you care for have DEEs or developmental and epileptic encephalopathies.
We are also a unit with in charge of rare epilepsies. So I can see some patients with rare epilepsies and support the families with the issues they can have with this sort of epilepsy.
What are common issues or common morbidities that they might have?
Often it's not the number of seizures, which is the real problem. It can be the behavior troubles, or it can be the main problem, in fact. And the seizure, the family learns to live with that. But when the behavior is a problem, it can be more hard and difficult.
And the behaviour, I suppose, does it relate to seizure activity or neurological abnormalities?
Not all the time, yes.
For the family, and the patient, not being able to predict mood, that must be really quite awful.
Yes, yes. It's really a difficult problem to say that this sort of person is in a bad mood or not. The family is the most important person to ask, because she's the right one who knows the best the patient.
I've heard that other common morbidities, and this isn't just in people with DEEs, but could be like sleep disorders, intellectual disability, more so in DEEs, correct?
Yes, you're right. They can have a lot of sleep disorders, and the nurse could be the good one to speak with the family, because they can give some advices to enhance these things.
Wonderful. Well, that's why one of the key reasons I appreciate you guys as well. Thank you.
Thank you.
Okay, so going a few thousand miles away, so thank you, Ludivine, to Patty, based in the US. Tell us about yourself and what you do.
Hi, thanks very much, Torie. I've been an epilepsy nurse at an epilepsy center in Boston, Massachusetts for over 35 years. And I've worked with people with epilepsy all the way from epilepsy might be their only problem to epilepsy plus multiple other problems, or it's affected their life in many ways. But I come at it from another perspective too, because in addition to working at an epilepsy center, I had worked at the Epilepsy Foundation, which is a kind of patient advocacy organization of the United States. So I've done some consulting on the side, and now working with the nursing section of ILAE to kind of help enhance the visibility and education for nurses. But the other thing that I think about here is really, how does it affect the individual and their family? Because I've lived with seizures all my life. And then my son had seizures for a number of years. So we were lucky that they've been pretty well controlled. But when I look at what a nurse can do and that importance and value of the nurse, I'm kind of bringing kind of a multiple perspectives to that.
Well, that's very valuable to people with the epilepsy, because I know actually several scientists who have epilepsy, but they're not open about it. And I'm sure it's the same with more and more clinicians. So it's wonderful to have you say that I've got this personal experience, and it really can contribute to the empathy you have for people.
The nurse or doctor or social worker, whomever it is that has epilepsy, I'll make a bet that they went through a lot of the same problems as a person without that, because it does take a while to get the right information and then to process that of what does that mean for me as an individual, and not what I think. What is my cognitive, my knowledge base think about epilepsy in general versus what does that mean for me? So they've probably been working through in the past or currently the same issues that anyone else with epilepsy has.
Totally. What are the sort of things that you talk about and advise patients?
The first thing I think it's so important for nurses is to really assess what the patient already knows and what does their family already know. Because by the time they're seeing a doctor or they see a nurse, you assume that they've been taught a lot or someone has discussed these things, all the way from what's a seizure and what do I do if my loved one has it to could I die during a seizure? Or why do I have to take this medicine? Or why are they talking about surgery? So we make a leap a lot of times to talk about these big topics, and people haven't had some of that basic information. Mm-hmm. So I never want to skip over that. I really want to start at where is that person at and how much do they know and what do they need? What are their priorities? You know, what's topmost on their mind first.
And also often I think that the people with the epilepsy, but also the caregivers will often be so stressed when we see a clinician that you can tell us something and then we forget it anyway. It's not necessarily, a clinician could have noted, okay, we spoke about this. But I think one of the responsibilities, is you kind of just implied, Patty, is that you have to find out, well, do you actually remember it? Do you understand it? Because maybe we don't.
You might see a nurse or doctor or whomever it is for 15 minutes, a half hour, even if you see them for an hour, that doesn't mean it's going to apply when you get home. Because when you get home, you need to think about, you need to remember it, and then you need to think about, well, how am I going to work that into my life? So I think it's so important. We write things down. We give them resources because they've got questions and issues that we can't address in those short visits. Mm-hmm. So, I mean, for me, a nurse means being aware of all of the whole person and what other things are out there that can help them. And don't think that I'm going to be everything for that person. I can only do this much.
So again, it's looking at them as a whole, as an individual, looking at what's around them, like their family or social, areas, and then talking about the things that nobody else will talk about or they don't feel comfortable talking about.
I think that's so important. I don't know how many times someone might have gotten along the way, just take an example. Maybe they're still having seizures. And so all of a sudden someone's talking, physician's talking to them about surgery or an implanted device. And when you really sit down with them and talk about their life and how are they doing, you find out they don't like the medicine that they're on, or they're having trouble remembering it, or a lot of stress in life that's affecting their seizures. And if you can address those core issues, maybe surgery or a device isn't really the route for them, or at least for now. So those are the things I think a nurse can really spend some time and tackle.
I see you agreeing with that, Ludivine. Is that right?
Yes, because I was thinking about a girl that I saw the week before, and she's a young girl of 12. We were talking about surgery and something like that, and in fact, when I talked with his parents, I saw that there was a lack of adherence with the treatment. Yes, because she's a young person, and the parents are not there in the morning, and so in the morning the treatment was not.
She was not taking it.
Yes, and so if we talk with the parents, the person, you can learn a lot of things, and you can change the way
how life is going in real life.
Yes.
Yeah. Good points.
Well, we are going to have an episode 2, aren't we, guys? Because we were going to have an episode 1 just to talk about the upcoming ILAE IB conference coming up. So everyone check that out. But just to give people a taster, what are we doing at the conference in Lisbon coming up?
So firstly, we will have an half-day nursing symposium, which is scheduled on Sunday afternoon. So the main topic will be individualized nursing care for people with epilepsy, promoting education and self-management. So you will be our first speaker, Torie. Yes.
Oh, don't clap yet. Oh my God.
And we will have a lot of nursing and caregivers and from all over the world. So they will present their point of view from different perspectives and what nurses can do to help.
Yeah.
And we will hear from a nurse from UK and also a nurse from Kenya, a country where the difficulties are necessarily completely different, and they will talk about the self-management and the health disparities.
We've got a couple other sessions going on. And so one is going to be, we talked earlier about the tough topics. So one of them is how to address the emotional or behavioral aspects of epilepsy, that it can be very complex and it's manifested in different ways. So we want to do this from the nursing perspective. And the whole approach that we're taking is that this is education for nurses by nurses. And we have other healthcare professionals helping, but we're trying to frame it around the way nurses see the needs or what we can do. And so in this aspect, we're looking about how's emotions and behaviors, what's causing them? How is it manifested? And then looking at it, how is it managed in an outpatient setting? Or what are some of the more common issues and how does that vary in different regions? And then kind of one of the unique issues that's a challenge for nurses is when you bring someone into an epilepsy monitoring unit, you're asking them to have seizures, you're taking away their medications, and of course, moods and behaviors are going to change, and it can often present a very challenging issue for the person, for their family, but also for the nurses and doctors caring for them. So we're going to talk about what the issues are there.
Thank you to Patty and Ludivine for sharing with us a little of what epilepsy nurses do and their value. Do get ready to hear about our talks on epilepsy nursing at the upcoming International Epilepsy Conference 2025 in Lisbon in next week's episode. Check out more about Patty and Ludivine and their work on the website torierobinson.com, where you can access this podcast, the video and the transcription of this entire episode all in one place. And if you're new and you haven't done so already, please do like and comment on the episode and subscribe to our channel so that we can get way more people around the world learning the facts about the epilepsies. See you next week.